What's happening, everyone? Dr. John Schott here from Balance Physical Therapy. Today we're going to talk about hip hinging. So hip hinging is a concept of being able to move from your hips during something like a squat or a deadlift. And so what we see a lot with people when we have them in the physical therapy clinic is that they tend to move from their knees a lot. What I mean by that is, say we're doing a squat, is that their movement is initiated from their knees rather than actually from their hips when they're going back. So it's gonna be a hard concept to kind of narrow down the idea that we actually want to initiate from the hips rather than from the knees, but it's important because with these exercises, what muscle group do we want to be using? We want to be using our hips, our glutes, our hamstrings, our hip flexors, all those big powerful muscles to do these big powerful type movements. So what can we do to work on how to hip hinge? We can start with grabbing ourselves a dowel, a stick, anything that is like this, and you're gonna take it, you're gonna put it against your back so that you have about 3 points of contact, meaning that you have one at your sacrum, one at about your mid-back, and then I have my head on here as well too. So in order to get my head on there, I kind of have to like tuck my chin a little bit more, but when I do that, now I'm gonna go into what would be like a deadlift position. So I'm going to lean forward, and in order to keep those 3 points of contact, the only way I can do that is by actually hinging at my hips. Versus if I want to move from my knees more, right, I'm gonna come away from the dowel. So use this as your guide and do it in front of a mirror as well too, so you can see how you're moving. But the key with it is that you got to move from your hips, right? And so I teach patients when I'm working with them in the clinic is, when you were going into that squat, that deadlift motion is, think about sticking your butt back first and then just letting your knees kind of bend along the way with you, right? So I stick my butt back, I keep going, and then my knees just kind of start to bend until now I'm doing a squat. Same exact thing for a deadlift. Now I'm leaning forward, my chest is coming forward, I'm still moving from my hips, and then when I come up, I initiate by driving my hips forward as well, okay? So the hip hinge is actually a fairly difficult motion. It looks very simple, but it can be really hard to kind of isolate that motion and not move so much from your knees. So like I said, try using the dowel, try doing it in front of a mirror. Really is good to get that visual and the contact feedback from those, okay? If you found this helpful, make sure to give us a like, follow us on Instagram, Facebook, and YouTube at Balance PT Move.